So I think the biggest fear people have is a robot actually operating on me? So what about safety? Are robotic surgeries riskier than the traditional open surgeries?
Yeah, studies have shown that, our experiences have shown that, and our results have shown that.
Many times I've heard people saying that you should only go for robotic surgery, like traditional surgeries are not good. So what is the criteria to decide?
It is not like that. It is the surgeon's responsibility to assess the patient and the disease as well, whether it is amenable to the robotic surgery or not.
Why EMC Hospital decide to bring this SSI Mantra 3.0 to Amritsar or Punjab?
People of Amritsar or people of Punjab should not go to other metro cities. That will also bring a huge cost to the patient.
Is the robotic surgery more expensive?
Well,
Welcome to the future of surgery. I am Dr. Rishab Arora, Director EMC Hospitals. So today we are at a very special location, that is EMC Hospitals, Green Avenue, Amritsar. So there's a very special and exciting reason to be here. That is, we have installed our new robotic system, that is SSI Mantra 3.0. So today amongst us is Dr. Rohit, who is MCH surgical gastroenterologist from SGPGA Lucknow and has done his fellowship from Germany and his MRCS London. So welcome, Dr. Sab.
thank you, Dr. Rishab. Pleasure is all mine. And definitely we will talk about our new installed system, SSI Mantra 3.0, and what all services we are providing at EMC Green Avenue.
So let's start with the basics of robotics and the myths people have. So let's start. What exactly is a robotic surgery and how is it different from traditional surgery?
Okay. So robotic system is a sort of advanced laparoscopic system. We have different arms of the robot, which we use in our different type of surgeries. And there is a console where the surgeon sits and take control of every arm of the robot. How it is different from our open surgeries, like in the open we have to go for larger incision to get hold of every tissue. In the robotic, all those incisions are not there, so that it give a more precision, less pain to the patient, faster recovery to the patient, and very importantly the magnification. Magnification is 10 times. So even the smaller bit of tissue which is not visible to the naked eye, we can definitely see with the robot, so that we can give a better treatment to the patient in terms of surgery.
So I think the biggest fear people have is a robot actually operating on me? Can you address this myth?
Yeah, very good question. I would say it is always the man or woman behind the machine. It is not the robo who will altogether take control of our human body. As I told you, there is a console which is totally under control of a surgeon and surgical team, and we operate it with the help of robotic arms. As I told you earlier as well, the advantage of using all these robotic arms is magnification, taking control of smaller tissues, and less blood loss. But yes, it is always the surgeon who takes control and who operates. It is the decision power with the surgeon only.
So what about safety? Are robotic surgeries riskier than the traditional open surgeries?
No. Robotic surgery is as safe as our traditional open surgery. Studies have shown that, our experiences have shown that, and our results have shown that. It is very safe surgery. If you, as you have asked me, as compared to open surgery, even I would say, even if we compare it with the laparoscopic surgery, it is as safe as all other surgeries.
Okay, but there's always a perception that robotic surgery is experimental. What's the reality?
No, robotic surgeries are there in the last 20-25 years. FDA has approved, India has approved. Even the European countries, wherever, as you told, I was there in Germany as well, they are doing this robotic surgeries. So robotic surgery is not at all experimental. Experimental phase is over, and now it is the reality. It is the future. Future of surgery lies with the robot.
So does robotic surgery take longer or it increases anesthesia risk also?
Yeah, the thing is, at the initial part of your career, there is always a learning curve for every type of surgery, be it a open, laparoscopy, robo. But once you master it, uh, it doesn't take much of a time. It takes only the usual time, and it doesn't increase the anesthesia risk at all. Risk lies with the that the pre-anesthetic workup of the patient. Whatever anesthesia workup we do in an open or laparoscopic system, same applies to the robo. So it is very safe surgery.
So we have already discussed the basics and the myths about robotic surgery. So now let's come to the patient benefits and recovery. So how does robotic surgery affect patient recovery compared to traditional surgeries?
Yeah, as we have already discussed, in traditional surgeries, we have to keep the patient for maybe a week or maybe for 5 6 days. But with the this advanced technology known as robotic surgery, we may discharge the patient in on the same day of surgery sometimes, but it depends upon the type of surgery. Maybe in the next 2 or 3 days post-operatively. So it cuts short the post-operative time in many surgeries.
So patient stay is cut off,
Yeah,
and
patient-
it automatically reduces to the cost of staying in the hospital.
Yeah, definitely. It also reduces the cost of the surgery and obviously the burden to the patient.
Great. So many times I've heard people saying that you should only go for robotic surgery, like traditional surgeries are not good. So what is the criteria to decide whether a patient we should go for robotics, or we should do it as a traditional or a lapro way?
Yeah, I think this is the most important question you have asked me so far. Many times we see that on various platforms, people claim that you should go for robotic surgery. It is not like that. It is the surgeon's responsibility to assess the patient and the disease as well, whether it is amenable to the robotic surgery or not. How much, uh, benefit it can give to the patient. Because the basic criteria for any surgery is complete removal of the tumor, if we talk about the tumor or the disease. So sometimes we have to combine robotic surgery with the open surgery, some part with the robotic, some part with the open, so that we can give a better benefit to the patient. And yes, not every surgery should be done by robotic only or open only or laparoscopy. It depends upon what is the condition of the patient and what is our intended goal, which is very important.
So people nowadays are very caring about their skin and going for cosmetic surgeries. So what about scarring? This matters a lot to patients.
Yeah, it matters a lot to the patient, and believe me, Dr. Rishabh, it matters to surgeon as well. Because if we give the smaller incision, obviously the cosmosis is very good for the patient benefit, and with the smaller incision, chances of surgical site infection is less from the surgeon's perspective. So yes, with the robotic being a smaller incision, it gives benefit to the both patient for the cosmetic reason and surgeon for the surgery benefit.
Now I would like you to explain like what all surgeries this robot can cover. And is this robot only for complex surgeries, or a patient with cholelithiasis or a hernia can come and get benefit too?
Yeah, this is a soft tissue robo. So one thing I want to make it clear is the robotic which we are talking about, it will deal with all the abdominal complex surgeries, not the ortho one. One
Okay.
thing is very sure. Second, we can do all the cancer surgeries with it. And yes, gynae surgeries, pelvic surgeries where the area is very less to operate, being a open or a laparoscopic surgery, robot give us a better view, 360-degree vision with the magnification. So practically speaking, we can operate any surgery on this system. But yes, we have to decide according to the benefit of the patient.
So I have seen many robos, and so what is special about this robo? As I am seeing that there are individual arms for this, multiple individual arms. There's not a central console. So what is the benefit EMC will get from this individual arms?
Yeah, again, I would say benefit for the hospital and benefit for the patient, and obviously for the surgeon when I'm talking about hospital. So, because it has a individual arms, you can see that we have a 4 or 5 arms operating at the same time. By reducing we can only use when it is needed. Okay, we can change the angle according to the concerned area where we need to go. it may be a difficult area, retroperitoneal area, pelvic area, thorax, which are like very confined areas where we have to operate. So we can change the angle, we can change the position, so that it is very safe for the patient and very safe for the surgeon as well. And it gives us a better precision, so that we can take out every bit of tissue and give a more benefit to the patient. So it is a better solution having individual arms as compared to a fixed arm system. It gives a better quality to the surgeon as well as a patient.
So it was very informative for me as well as for the viewers. So my next question is, how does this SSI Mantra 3.0 compare to other robotic systems globally?
Yeah, as you can see, and we have discussed that it is an open console system. Arms which are free, not fixed to one point, so that gives us a more degree of freedom. Second, obviously, it is made in India, according to the concept of Make in India, as run by our government of India. Third point I would like to say is, the concept of telesurgeries. So telesurgeries, if I'm sitting here and same robotic system is there in, say, one of our peripheral center, for example, you can say Gurdaspur or at the Pulse Hospital, and we can operate from such a longer distance. We can give the same quality of surgery to our patients who are there in our peripheral hospitals. So that makes it a marvelous thing to give a better and state of the art surgical things to our patients.
As I am the host today, so the next question I'm going to ask you should be asked to me. So it's a very exciting, interesting question, that why EMC Hospital decide to bring this SSI Mantra 3.0 to Amritsar or Punjab?
Yeah, well, Dr. Rishab, I would like to say over here that it is not just SSI Mantra. EMC Hospital as a group is very much dedicated group to bring all the high-end facilities at one roof for the benefit of the patient, and SSI Mantra 3.0 is one of them. If you see my OT, my Gastro Surgery department, you will see that we have all the high-end instruments, all the high-end facilities for our patient. So in that goal of the EMC decided that we should have a robotic system for the betterment of the surgical patients, for giving them all the world-class surgeries under one roof. People of Amritsar or people of Punjab should not go to other metro cities or other institutes, and that will also bring a huge cost to the patient, and obviously traveling and all that stuff. So we are very much committed to bring all the high-end things under one roof, and you will see in the future we will maybe having the upcoming things, other surgical procedures which are not done yet in Amritsar.
Transplantations you are talking about?
I'm talking about transplants. I'm talking about few procedures which are before the transplants. Yeah, definitely our goal is to ultimately start the transplant unit. But before that, we have to bring, few other things. Very shortly, we will be discussing that as well, what all things we are having here.
As you are already doing liver resections and pancreatic cancer surgeries, so these complex surgeries, do you think these are possible on this robot?
Yeah, very much. Very much, I would say, like with the results as comparable to as the open surgery. All the liver resections can be done on this robotic system. All the pancreatic cancer surgeries can be done on this robotic system. Obviously, we have to choose which patient will go for a robotic and which will go for the open surgery. But yes, all the liver and pancreatic cancer surgeries can be done on this system.
Great. We have talked about the basics and the benefits a patient gets from robotic surgery. Now let's come to the elephant in this room, that is cost. Is the robotic surgery more expensive?
Well, if you ask me this question, so I would like to answer like this, that if we talk about the instrumentation, what all things are used during the surgery, that is definitely costly as compared to our traditional surgeries. But if you ask me, like, about the overall cost, that is always comparable, because stay after robotic surgery is less, cost of medications is less, ICU stay is less. We are discharging the patient, just after say 2 or 3 days. So overall cost is very much comparable with our traditional surgeries.
What is standard recommendation for robotic surgery?
Well, now the standard recommendation is we can go ahead with the surgery using our robotic platform, which will definitely give the benefit to the patient. So I would say whenever needed, we should go for a robotic surgery.
It's been 2 months we have started robotic surgery at EMC Hospital, Green Avenue. So what is your real-time experience?
Well, I want to be very real for this particular question. We have done quite a number of surgeries, and mainly the cancer surgeries. As a team, we were very happy when our patient was out of bed on the same day of the surgery, tolerating orally on the very next day, and we could discharge the patient within 3 or 4 days. So that cut short the hospital stay timing, and patient and surgeon both are happy.
Every country and most of the companies are putting the effort into innovations and future. So what do you think, like, EMC is putting their input in the future in robotics, and how do you see robotics in future in 2026?
Well, robotics are the future, no doubt about that. And EMC and our department is very much committed towards that. And regarding the newer advancements in robotics are associated with artificial intelligence, AI, ICG mediated surgeries, telesurgeries, 3D technology, 4K depth perception, and for our viewers, all these things are already enabled in our robotic system. So we are keeping pace with the future in robotic surgeries.
Now let's address some patient concerns. What advice would you give to the ones who are hesitant for going for robotic surgery?
Well, my advice to them is don't be hesitant. It is a very safe procedure, and believe me, it is not the machine. It is all those surgeons which are like expertise and experienced, who are operating on through this platform for their specific patients. So don't be hesitant. It is a very safe surgery, and it improves the quality of life, which is the main crux of any surgery. So it improves the quality of life for the patients. So don't be hesitant.
Dr. Dhawan, as you and your team are available at EMC Hospital for consultation, what is the way to connect you, and when can they come and consult you?
Well, my team is available 24 into 7, and you can connect us through our OPD timings, through our website. You can prior book the appointment and you can consult us.
Dr. Dhawan, thank you for simplifying robotic surgery for us today. I think what's clear is that this technology isn't about replacing surgeons, it's about empowering them to provide better outcomes for patients. For our listeners, if you are facing a surgical procedure or want to learn if robotic surgery is right for you, EMC Hospital's team is here to help. We are proud to be bringing the SSI Mantra 3.0 systems to Amritsar, making world-class robotic surgery accessible right here in Punjab. Remember, modern healthcare isn't about choosing between technology and human expertise. It's about combining both for the best possible care. Visit EMC hospitals or call our number for a consultation. Until next time, stay healthy, stay informed.